Hi, I'm Dr. Brandon, and welcome to Medical Minute with Norton Healthcare. If you're feeling sick and can't make it to your primary care office, you might be wondering, what are my urgent care options and which one is right for me? Let's break it down. First, let's talk about virtual care, also known as telehealth. This is a great option if you're too busy to visit a doctor's office in person or just don't feel well enough to leave home. With Norton eCare, you have two choices: a video visit, where you meet face-to-face with a provider through your phone or computer, or, if you prefer, you can do an e-visit, where you fill out a questionnaire and get a response from a provider, no video required. Most virtual visits cost the same as a copay for an in-person visit and are covered by insurance. Norton eCare is available for patients aged 2 and older in Kentucky and Indiana and works well for minor issues like skin rashes, UTIs, sore throat, cough, diarrhea, pink eye, and even lice. But not everything can be treated virtually. If you have an ear infection, a suspected broken bone, dehydration, or a cut that might need stitches, you'll need an in-person visit. That brings us to clinics, like Norton Prompt Care. These clinics are a great choice if you'd rather schedule a same-day appointment and avoid waiting. Here, you can get quick treatment and testing for things like strep throat, flu, and minor infections. But they also offer flu shots, TB tests, vaccines, and even last-minute school, sports, or annual physicals. Norton Prompt Care treats patients as young as 12 months old and has evening and weekend hours, making it a convenient option when your primary care provider isn't available. For more serious but non-emergency issues, your best option is an urgent care center, like a Norton Immediate Care Center. Unlike the other two options, Norton Immediate Care Centers have on-site x-rays, expanded lab testing, and more treatment capabilities. You can walk in anytime or use the Reserve Your Spot feature, which lets you get in line and receive a text when it's almost your turn. This is the best choice if you have severe flu symptoms, a minor cut that needs stitches, a minor fracture or sprain, severe ear pain, or a UTI that isn't improving. Urgent care centers are not appropriate for intense migraines, major fractures or dislocations, or anything that may require an MRI or surgery. While any of these urgent care options are faster and more affordable than going to an emergency room, there are times when you should call 911 or go to the ER immediately. If you have chest pain, trouble breathing, stroke symptoms, sudden severe pain, uncontrolled bleeding, or a head injury that causes loss of consciousness, don't wait. Get emergency help right away. So what's the bottom line? Virtual care is great for minor illnesses and convenience. Retail clinics are best for quick, routine, in-person care. Urgent care centers are your go-to for more serious but not emergency needs. If you're ever unsure, call your primary care provider. We're happy to help. For same-day care options, visit nortonnow.com to book online or call 502-629-1234, option 3. Stay healthy.